We talked about how inflammation affects the illnesses and the experiences we have. No better example than COVID and the pandemic. Many individuals were exposed to COVID, but not everybody had the same symptoms. A relatively small but significant part of the population had more severe symptoms or devastating outcomes. Why is that? The virus is the same, but how their body responded, how their body reacted, either genetically prone or environmentally prone, is what made the symptoms more severe. And that actually can be taken by extension to MIS-C, which is the multi-system inflammatory syndrome of children, which is a sequel of COVID infection in some individuals. It involves multiple systems in the body being inflamed, fever, body aches, skin conditions, cardiac conditions. What's been studied but not well appreciated in the clinical setting is that the same kids who are prone to higher inflammation are more prone to have symptoms of MIS-C. So if we know beforehand who's prone to inflammation, we can predict and anticipate their high risk for MIS-C and manage them at an earlier stage. Another perfect example is long COVID. It's in the news, everybody's concerned about it, but it's not a random phenomenon. It's certain segments of the population who inflame more, have more symptoms, and that's why they share the conduit of that which affects chronic fatigue syndrome, for example, or many other chronic ailments. They share symptoms in common because they have the same fuel, the same conduit, the same underlying predisposition.